Hello, I'm Dr. Jeffrey Spiegel, facial plastic surgeon in Boston, Massachusetts. And I wanted to talk to you today about when you should not be using Botox and places you should not be using Botox. And when I say Botox, I don't just mean Botox brand. I mean Botox or Dysport or any of the other brands, Xeomin, the new ones. When should you not be using these types of muscle relaxants? Because I get people who come in all the time and they'll say to me, I saw a doctor, he recommended Botox or another botulinum toxin preparation to treat the following wrinkles, lines, problems, and it is a bad idea. And I'm going to tell you where it's a good idea and why it's a bad idea in certain places. It is a good idea in general from your lower eyelids up. Most of the time that's not going to cause a big problem. Botox is great for treating crow's feet lines at the side of the eye. It is great for horizontal lines at the bridge of the nose. It is great for vertical lines between the eyebrows. It is pretty good for horizontal lines across the top. Why did I say pretty good? Well, it relaxes them, but if you don't do this area right, your eyelids can take on a wrong shape. Not eyelids, your eyebrows can take on the wrong shape. Your eyebrows can tilt and make you look confused, they can tilt and make you look angry, or they can rise in an otherwise severe form. When I do this, I pay very careful attention to how the medication is going to affect your eyebrow position. And I will tell you that, for example, a certain line that you want to treat is a bad idea to treat because it's going to affect your eyebrow. I'm looking to help you look your best overall. We're not trying to treat one specific spot. I want you to look as good as you can using all the technology we have available. Now, so Botox is great for these areas, but what about lower on your face? What about little vertical lines on your lips, where from smoking, for example? Now, what about other areas? What about, for example, lower in the face, for example, around your lips? People will come in and they'll have little vertical lines on their lips that drive them crazy. They'll say, I had this from smoking. I still smoke. Hopefully you've quit. Or I used to smoke. Better situation. Or maybe it's from something else. Maybe you're just very expressive and you get these vertical lines around your mouth. And people will say, I want to use Botox. And my doctor told me Botox is great. It's going to relax this area and make it look much better. Well, this is a bad idea. Simply put, this is a bad idea. Maybe it'll work. Maybe you'll be lucky. Maybe your doctor will put in the right amount that will slightly relax your lip. But don't forget, it is a muscle relaxant. It's going to weaken the muscles. It's going to make it so that your lips don't move normally. People watch each other's lips. We look at people's lips to see what they're saying. We look at their lips to see how they're feeling for their emotions. We look at their lips to see if they want to kiss us, all sorts of nice things. And if your lips aren't moving right, it's going to be a problem. If you put in too much, your lips aren't going to move at all. And you're going to look like you've had some sort of injury, God forbid a stroke or something. If you put in just the right amount, maybe it'll take care of the wrinkle. It's still going to affect the way your lips move, and it's not going to last a very long time. So it's going to be a waste of money in addition to taking a medical chance. So this is just a bad idea. Sometimes people will suggest doing it in wrinkles in the neck. Once in a while, that's a good idea. If you bear down like you're going to lift a heavy box and get tight bands in your neck, maybe Botox works well in those situations. But most of the time, it's loose skin that people are seeing, and it's time for a surgical option. Similarly, for around your lips, this doesn't mean because we can't use Botox that you're out of luck and you need to have surgery. Some surgical solutions are great. For example, I urge you to look at my video on lip lifting, which is a very effective way to treat some of these issues. But we can also fill in your lips. Now, this doesn't mean you need to have lips that are large like Angelina Jolie. It means that we can put in just enough to make your lips slightly larger, which stretch out those little fine lines and make them go away. And I have many people who come to see me for that and love the way they look without feeling like they've gone overboard. So remember, certain areas are good for botulinum toxin and others are bad. Make sure that the doctor you are seeing knows what he or she is talking about and that you get an excellent result. If you're looking for more information and want to ask me a specific question, please go to our website at www.drspiegel.com, and I look forward to hearing from you.